All right, today we're here to talk about ankle sprains. Here I have a foot model that shows the most common ligament that is injured. It's called the anterior talofib or ATF ligament. Usually occurs with my young athletes or even adults from an inverted type of injury where they plant the foot down and then sometimes their momentum or someone pushes them where it inverts or brings the foot in and pulls on this ligament. It is the weaker of the three ligaments on the outside and usually either gets stretched, sprain, or torn, tear. And that requires our services in trying to heal. Here on the display you can see the type of injury I'm talking about, an inversion type injury. And the ligament here, the ATF ligament, it is torn here, and then when we really get a bad injury, sometimes the other ligament on the side gets torn, and that usually requires surgery when we get two ligaments that are torn instead of one. Now the therapy for ankle sprains starts with immobilization. We have to determine after the physical exam what type of swelling and pain that they have. Minor swelling, minor pain, you can get back on the court or the field in a couple of weeks after resting it, ice, compression, and making sure that you elevate it. If it's a little bit more aggressive or more injury or more swelling is occurred, it's going to be a little bit longer. We have to sometimes put them in a walking boot or a cam walker, what we call, and immobilize. And then after that period of maybe 10 to 14 days, we start going after it, more or less like in therapy, trying to strengthen the areas. There are tendons that come across this area that in therapy we have to go and try to strengthen, because once the ligament has been compromised, it's truly never the same. And so we have to call on the other tendons around the ankle to come in and strengthen and support this area. So as the patient or the sport athlete is making that move and it wants to go again, those muscles are pulling back and going, no, we're not going to let you go and go all the way and re-injure this. It can sometimes still happen depending on the injury or the force to the patient or the sport athlete. But after the initial immobilization and the therapy, we usually in about 2 to 4 weeks can get back into normal activities. And sometimes after that point, if the patient feels still that they're a little weak, we can get them into an ankle brace or an ankle gauntlet, what we say, and help support until they feel comfortable and to get back out on the field again.